Hi guys, and welcome back. Now we're gonna complete our talk about the larynx, and we're gonna talk about the muscles of the larynx, the blood supply, innervation, nerve injury, and the basic idea about the histology of the larynx. Now, to talk about the muscles of the larynx, we have structures or muscles that connect my larynx into the surrounding structures extrinsically. All right. Now, I have muscles that are important as they move the larynx, and they are considered as extrinsic muscles. And these muscles are actually the muscles that are connected to the hyoid bone and the structures outside of the larynx. And these muscles are elevators. They whether elevate the larynx or they depress the larynx. We have suprahyoid muscles, muscles attached to the hyoid bone superiorly, and from the name implies, the suprahyoid would elevate. And then we have infrahyoid muscles, and they are attached to the hyoid bone down inferiorly, and they would, when they contract, they would bring the hyoid bone as well as the larynx down, because this is of course your laryngeal prominence, this is the thyroid cartilage, and down to that the cricoid. So this is basically your larynx here, and this is the hyoid bone, remember, and the trachea was down. So this is the cricoid, this is the laryngeal prominence, and this is the hyoid bone. Now, what are these muscles? We have the digastric muscle. We have two bellies of digastric. This is anterior belly and this is posterior belly. You have the stylohyoid, which cannot be seen here. We have the mylohyoid, which is the muscle that makes the floor of this triangle here of the neck. All right, this comes from the mylohyoid line all the way to the hyoid bone. And then we have the geniohyoid, which is a deep muscle. We cannot see it here. And these are elevators of the larynx. Now, the depressors are the muscles that attach down to the hyoid bone. We have one that comes from the sternum to the hyoid bone, all the way from the sternum, all the way to the hyoid bone. So we call it sternohyoid. And then when we reflect the sternohyoid laterally, we will see two muscles. It's kind of, we are breaking down this muscle, kind of. It's not, this is not true, but just hypothetically, consider that you are breaking down this muscle into two daughter muscles and having the thyroid in between them. So instead of sternohyoid, you will have sternothyroid and thyrohyoid. That will help you to memorize the names of the muscles, the infrahyoid muscles. So you have the sternohyoid, and break it down into sternothyroid and thyrohyoid. And the last one is actually omohyoid, and this is the one that moves laterally. It goes to the shoulder. It's connected by a tendon to one of the bones of the shoulder, and omo means shoulder in Latin. So the omohyoid is actually one of the depressors of the larynx. All right. Now, what are the intrinsic muscles of the larynx? Now, when we talk about the muscles that work in the larynx, I want you guys to think about two things. We're going to talk about them as muscles that causes tension and relaxation on vocal folds, and in other words, we can say lengthening. Tension, we can also say it lengthens the vocal folds. Relaxation, it also like shortens the vocal folds. All right, so we have muscles that can cause tension, relaxation on vocal folds, and we have muscles that can cause abduction and adduction, and we're going to talk about that in the next slide. So whenever you think about the muscles, intrinsic muscles of the larynx, I want you to remember that we are either describing muscles based on the tension and relaxation on vocal folds, or we're talking about things that opens the glottis of the larynx by abduction and adduction, the rima glottis here. Here, can you guys see this? By abduction and adduction, and we're going to talk about that in a while. Now, when we talk about tension or lengthening and shortening on vocal cords or vocal folds, remember that the thyroid is involved. The most important thing in the tonation on phonation and in talking is to work on the vocal folds, guys. All right. So the thyroid is a very important cartilage. So it is involved when we talk about the muscles that causes lengthening or tension on the vocal folds, or relaxation or shortening on vocal folds. Okay, so we have thyroid. Now, remember when I told you the most important cartilages in the larynx are the thyroid, the cricoid, and arytenoids? So the arytenoids, the cricoid, and the thyroid. All right. So now I want you to remember the same concept. These three cartilages are the most important ones. Now, if I want to work on the thyroid, if I want to work on tensioning and relaxation of vocal folds, thyroid is involved. So I'm whether attaching a muscle between thyroid and arytenoid, or I'm attaching a muscle from the thyroid to the cricoid. All right. So I have cricothyroid and I have thyroarytenoid. All right. So I have cricothyroid muscle, I have thyroarytenoid. Both of the muscles are attaching the thyroid to one cartilage. If that cartilage is the cricoid, that's going to be for tensioning. Why? Because you guys look at the cricothyroid muscle. It's the only muscle that comes from anteriorly. This is the only muscle that can bring the thyroid anteriorly and lengthen the vocal fold. All right. And then I have the thyroarytenoid. Think about it. It's a muscle that comes from the thyroid posteriorly all the way to the arytenoids. So what do you think will happen if I contracted this muscle? Yes, of course. I'm going to shorten the vocal folds. I'm going to relax the vocal folds. I'm going to have high pitch sound. It means your sound is going to be low. Sorry, I said high. It's going to be low pitch sound. Like what I'm saying now, this is a low pitch because I'm shortening the vocal folds. But if I want to have a high pitch sound, it means I'm stretching the vocal cords. It means I have to bring the thyroid anteriorly away from the arytenoids. And that can only be done by the cricothyroid muscle. The cricoid is here, thyroid is there. I need to bring the thyroid anteriorly because I want to bring it away from the arytenoids, away. When the thyroid moves away from the arytenoid, this is the only way I can have a high pitch or stretch the vocal cords or lengthen them. However, if I bring the thyroid towards the arytenoids, because basically your vocal cords are formed by the connection of these cords between the thyroid and arytenoid. So if I move the thyroid towards the arytenoids, it means I'm shortening, I'm loosening, I'm relaxing, I'm having low pitch sound. And this is by moving towards each other. So if I bring the thyroid posteriorly. Now, these two diagrams are taken from a very nice video on YouTube, and that video is how the larynx produces sound. I would advise you guys to go ahead and watch it, and I will share the link in the description box. And thanks to that video, because that will help you guys understand how do these muscles work. I'm gonna play the videos now. I took parts of that video that would serve to understand the part I'm explaining now, but the full videos of other stuff regarding the larynx is there in that video. You guys can go and go ahead and watch it. All right. Now let's see how the thyroarytenoid muscle works. How do we move the thyroid posteriorly and shorten the vocal folds? You guys see? How do we move the thyroid towards the arytenoids? All right, now let's see how the cricothyroid is the only muscle that can bring the thyroid anteriorly and move it away from the arytenoids and lengthen and stretch the vocal cords. You guys see how we are lengthening the vocal cords? Because the muscle is attached outside here, so when it contracts, it brings the thyroid anteriorly, and that will lengthen the vocal folds. Now, the other thing when we talk about the function of the intrinsic muscles of the larynx is abduction and adduction, and this is important for anything regarding breathing, whispering, We want to have more air getting in. We want to close off and prevent air from getting out. All right. So that will be abduction and adduction. Remember when we said that in phonation and in lengthening and shortening, thyroid was involved? Here, thyroid is not involved. And remember when I told you the most important cartilages, they were the cricoid and arytenoid. So if thyroid is not here, it means we will only hear cricoid and arytenoid. So we have posterior cricoarytenoid, we have lateral cricoarytenoids, all right? Plus we have the transverse and oblique arytenoids. I want you guys to know that the transverse and oblique arytenoids are always helpers for the functions that we said that that can be done by more than one muscle. Remember when I told you that the tensioning on vocal cords here can only be done by cricothyroid? It means the arytenoids cannot help. They can help in shortening and relaxation of the vocal folds. All right? Here, when we talk about the abduction and adduction, the arytenoids, they can help in adduction. Okay, they can help in adduction, but the only muscle that can cause abduction is the posterior, P and B. So the only muscle that can do abduction is the posterior cricoarytenoid, because thyroid is not involved in abduction and adduction. The only muscle that can do tension here was cricothyroid, the only muscle. So the shortening of vocal cords can be done by the thyroarytenoid plus the arytenoids. The transverse and oblique arytenoids can help in the other function. So we have one function that can be done by only one muscle, and the other function can be done by more than one muscle. And the more ones would be the arytenoids, transverse and oblique. Okay, they can help the thyroarytenoid here. They can help the lateral cricoarytenoid in adduction, but they cannot help here in abduction. It's only by posterior cricoarytenoid. They cannot help in tensioning. In the previous slide, that was only by cricothyroid. All right. Now, when do we need the adduction? When we want to close off the rima glottis and we want to close off that, we bring them together in whispering and coughing or sneezing. We need to close off the larynx, and that would be done by the lateral cricoarytenoid. Thyroid is not involved. So anything with the important cartilages would be the correct name of the muscle. The cricoarytenoid lateral one would do adduction, and the transverse and oblique ones will help. Let's look at the function of the muscles. And again, thanks to the video by how do muscles of larynx produce sound. Let's look at them and see how do they work. But even after understanding here, I gave you on how to clues on how to remember the function in any theoretical exam if you cannot imagine how do they work. Now let's look at the transverse and oblique arytenoids. How do they adduct the vocal folds? So this is how the transverse and oblique arytenoids work. All right. Now this is how the lateral. Oh, sorry. This one comes first. So look, guys, how this is abduction happens by the posterior cricoarytenoids. All right. And the last one is the lateral cricoarytenoids. This is how do they work. By contracting, they adduct the vocal folds. Now let's talk about the innervation. All muscles of larynx are supplied by recurrent laryngeal nerve except the cricothyroid. All right. All muscles are supplied by recurrent laryngeal nerve except the cricothyroid. This is the most important. It's a very important muscle. Without this, I wouldn't have been able to explain nicely this presentation and that video, because that helps me to change my tone. Remember, this is the only muscle that brings the thyroid anteriorly and makes me to change my tone. Without that muscle, everything would have worked here at the back, creating a monotonous voice, which means I'm going to talk about in a monotonous voice like what I'm doing right now. This is going to be very boring. All right. So thanks to the cricothyroid muscle, thanks to the external laryngeal nerve that supplies the only muscle that can help me to change the tone of the voice. So if I have injury in that lat nerve, which is the external laryngeal nerve, I would have had a monotonous voice. Now, what about the rest of the muscles? The rest of the muscles are supplied, all of these muscles are supplied by recurrent laryngeal nerve. So if I have an injury to the recurrent laryngeal nerve, I will have hoarseness of voice. It will be very difficult to talk because they are basically supplying everything, and it will be very difficult for the muscles to move. All right, so that will be hoarseness of voice. All right, now this is if it's so unilateral, okay, because that will happen in one side and the other side will try to vibrate and create a sound. However, if I have a bilateral injury to both sides, that will give me snoring, stridor, difficulty breathing, and if it's very severe, it's going to be aphonia because nothing can move and I cannot talk. If I have complete injury to both recurrent laryngeal nerves, I cannot talk because all of these muscles are not going to move and I will be left aphonic. All right. We already talked about the function. Now moving on to the last part, which is the part before the last part, because we have the histology. It's basically the blood supply and innervation. Now remember, guys, that we have laryngeal vessels because we are supplying a larynx, and we have superior laryngeal artery and inferior laryngeal one, and they are coming from the superior thyroid and the inferior thyroid. All right, so from the inferior thyroid artery, you have the inferior laryngeal artery, and from the superior thyroid artery, you have your superior laryngeal artery. This is easy. Now, what about the nerves? We have the vagus nerve. The vagus nerves give you superior branch and inferior branch. The superior branch is the superior laryngeal. It comes at some point and then it divides into two parts. Internal one that goes all the way, and remember when we pierced the thyroid membrane and we talked about the pyriform fossa and how this injury can, how can this nerve get injured if things happen in pyriform fossa. This is the internal laryngeal, and from the superior laryngeal also we have the external, and that is the only motor branch to the cricothyroid muscle that was causing tension on the vocal folds and high-pitched sound. Remember, that was the muscle that brings the thyroid anteriorly and causes tension. All right, so these are branches of the superior thyroid. Now, of course, I want you to remember that your cutoff point in the larynx is the vocal folds. So if something has a name superior, it means it supplies things above the vocal folds. And I think you guys remember the vocal folds in the coronal section we had in the previous video. All right. And if we have something that supplies down below the vocal folds, it's going to be the inferior laryngeal nerve. It's very important to mention here that they found that the inferior laryngeal nerve, it winds around the arch of aorta on the left side and the subclavian artery on the right side. So they decided to give it another name, which is the recurrent laryngeal nerve. Recurrent, it means it goes and comes back. All right. So this is nothing but the inferior laryngeal nerve that supplies all the muscles of the larynx and sensations below the vocal folds. However, the superior, it gives two branches, one sensory, which is above the vocal folds, and one motor, which is only for one muscle, which is the cricothyroid muscle. All right. Regarding the lymphatics, we have lymphatics from the larynx. It goes to, again, your cutoff point is the larynx. So above the vocal folds, the lymph vessels would drain into nodes. Remember the general idea of the lymphatic system. If you guys don't know it, go ahead and watch the overview of lymphatic system video of my channel to understand how does the lymphatic system work. It's basically by bringing lymphatics into the capillaries and draining them into lymph nodes, and from a node into trunk. And from that trunk, you need to decide whether you're going to right lymphatic duct or thoracic duct, and then you eventually drain into the left or right angles. If you guys don't understand these, go ahead and watch the overview of lymphatic system and come back to the slide to know how things work. So lymphatics above the vocal folds, they drain into the superior deep cervical lymph nodes. And below that, it goes to the inferior deep cervical lymph nodes. And from that, the name of the lymphatic trunk regarding the larynx is actually the jugular. So if you're on the right side, you're draining into the right jugular lymphatic trunk. If you're on the left side, you are in the left jugular lymphatic trunk. And of course, from the general idea of the lymphatic system, you know that if you are on the left, you're draining into the thoracic duct. If you are on the right side, you're draining into the right lymphatic duct, and from that into the right or left angle. Now here, last thing is the histology of the larynx. Remember that above here we had the vestibular fold, and down we have the vocal folds. So above that we were following the respiratory system, which is having pseudostratified ciliated columnar epithelium with goblet cells. So you guys can see many glands, and because here your purpose is to breathe, and your purpose is to trap any molecules by the secretion of the goblet cells and bringing them outside. So we need these seromucous glands. All right. However, below at the vocal folds area here, your purpose is to talk and cause phonation. And because we are bringing the folds together and talking a lot, there is friction. And you guys know that histologically, if I have a place that has friction, it needs to be stratified squamous epithelium, because we need to protect the downmost structures. And there is, if we have a simpler epithelium, we would have gone into injury and abrasion and so on. So in the vocal folds, we have stratified squamous epithelium. But in the vestibular ones up here, it was following the breathing concept, which is the pseudostratified respiratory epithelium. And then down to that, you have your connective tissue, and down to that, you have your muscle. So the vocalis muscle, or the thyroarytenoid muscle, that the muscle that forms the vocalis, which is the muscle that connects the vocal processes of arytenoids to the thyroid. This is basically what you have in your core. And between your muscle and the epithelium, you have the connective tissue layer, which is the lamina propria. This connective tissue layer will split into two parts. Superficial part, which is what we call the Rhenkus space. This space is loose connective tissue. It has more of cells than fibers. However, the lower part of the lamina propria, or the connective tissue part between the epithelium and the muscle, is actually more fibers, because this is actually your vocal ligaments. All right, so vocal ligaments, it has more of fibers, elastic fibers, collagen fibers, and so on. So these are the two parts of the connective tissue between the epithelium and the vocalis. And of course, down here, you have your cartilage, because your larynx is basically a cartilaginous structure connected by membranes and muscles. So of course, this is a typical cartilaginous section that shows the chondrocytes in lacunae, which is the hyaline cartilage of your whatever. If you are here, this is the thyroid. If you're down here, this is the cricoid. All right, so this is a general idea of the histology of the larynx. Thanks, guys, for watching. Don't forget to like and subscribe, and see you